Welcome to Outbreak Brief, the podcast that takes you inside the world's most dangerous infections. Today, we are tracking an infection caused by a microscopic corkscrew-shaped bacteria that hijacks a poppy seed-sized carrier to invade your nervous system, your heart, and your joints.
Yeah, it's really an absolute masterclass in evolutionary infiltration. I mean, it slips past our defenses completely unnoticed until it's basically already set up camp deep inside our most vital tissues.
Right, and when we step into the woods, we're sort of conditioned to look out for the big, obvious threats, right? We scan the brush for bears, or we listen for the rattle of a venomous snake, maybe check our boots for spiders.
Exactly. We worry about the things that roar or sting or, strike with a dramatic bloody bite.
But the most life-altering predator in the forest, or honestly, even just sitting on a tall blade of grass at the edge of your own peaceful backyard, it doesn't make a sound, you won't feel it land on your skin, you won't feel it bite.
Because it's a creature the size of a single poppy seed.
It's terrifying when you really think about it.
It is. And that silent attachment, it begins a cascading biological process that affects just a staggering number of people. We're looking at an estimated 476,000 people diagnosed and treated for this infection in the United States every single year.
Wow. Nearly 500,000 people. And it strikes so quietly, it often begins with just a creeping, expanding bullseye rash. And if left unchecked, well, it can completely alter the course of your life.
Yeah, it really can.
So today in this deep dive, we are talking about Lyme disease. But to really understand the disease, we have to look at what is actually invading the body.
Right. So the pathogen responsible for Lyme disease or Lyme borreliosis is a bacterium, but specifically it's a spirochete.
A spirochete.
Yeah. And in the United States, the primary culprit is called Borrelia burgdorferi. And in very rare cases, a newer species called Borrelia mayoni.
Okay, wait. So if this bacteria is in the U.S., Europe, and Asia, are we all basically fighting the exact same bug, or does it adapt to the geography?
Oh, it definitely adapts. The pathogen has these distinctly regional flavors, I guess you could call them, and they attack the body quite differently.
Really? How so?
Well, the U.S. strain, Borrelia burgdorferi, it has a really profound affinity for your joints, causing severe arthritis. But over in Europe and Asia, the dominant strains are different. You have Borrelia guarini, which strongly prefers nervous system tissue.
Oh, wow. So it goes straight for the nerves.
Exactly. And then Borrelia avicellii tends to target the skin. But no matter the variant, they all rely on a highly specific delivery system, which is the Ixodes genus blacklegged tick.
Right, the infamous tick.
Yeah. On the East Coast, that's the deer tick, or Ixodes scapularis. Out west, it's the western black-legged tick, Ixodes pacificus.
Okay, let's unpack the structure of this pathogen for a second, because a spirochete is literally shaped like a corkscrew, right?
Yes, exactly like a corkscrew.
Which is wild. I mean, it doesn't just float passively through the bloodstream like, other bacteria. It physically drills its way into our tissue.
It does. That spiral morphology acts as a microscopic drill bit. The bacteria has flagella, which are these tiny motor-like appendages, but they're hidden inside its inner and outer membranes.
Hidden inside, so it's like an internal motor.
Exactly. When these motors turn, the entire bacteria twists. And this corkscrew motion allows the spirochete to bore directly through thick viscous fluids and really dense connective tissues like cartilage, where our immune cells actually struggle to follow.
That is incredibly sneaky.
It's a huge mechanical advantage. That's exactly why it can embed itself so deeply into the joints and the heart.
But ticks aren't born with this corkscrew drill bit inside them, though. They acquire it, right? To understand how this ends up in our bloodstream, we really have to trace the 2 to 3 year life cycle of the black-legged tick.
Right, so they go through 4 life stages: egg, larva, nymph, and adult.
Okay.
When the 6-legged larvae hatch from their eggs in the leaf litter, they are completely uninfected. They're harmless. But they need a blood meal to survive and molt into the next stage.
Right, and the turning point happens when they find that first meal, usually a small rodent like a white-footed mouse, or, a vole, or sometimes a foraging bird.
Exactly. And these small animals are the actual natural reservoirs for the Lyme bacteria. So the tick drinks the infected blood of a mouse, acquires the Borrelia bacteria, and then basically goes to sleep for the winter.
Okay, so it wakes up infected.
Yeah, in the spring, it wakes up as an 8-legged nymph, totally desperate for its next meal. And if that nymph latches onto you, it passes the infection along.
Wait, let me stop you there. Because they're called deer ticks, doesn't the deer infect them? I think that's what everyone assumed.
I know, it's a huge misconception. Deer do not carry the Lyme bacteria, and they cannot infect a tick.
Really? None of them?
No, none of them. Deer are critical to the tick's life cycle, but purely as a final transportation network. And, well, a massive blood meal for the adult female ticks to mate and lay thousands of eggs.
So the deer are just basically the bus and the buffet.
That's a perfect way to put it. Yeah, the bus and the buffet. But the mice are the actual biological source of the disease.
Okay, so transitioning from the forest floor to human skin involves this really fascinating piece of biology. Because the bacteria doesn't just flow instantly into our bloodstream the second the tick bites.
No, not at all. The bacteria actually live dormant inside the tick's midgut. When an infected tick latches onto you and begins to feed, the sudden influx of your warm, fresh blood acts as this massive environmental alarm bell.
It wakes them up.
Exactly. It triggers the spirochetes to rapidly multiply. And during this multiplication, they undergo a really crucial physiological transformation. They suppress one type of surface protein and begin to heavily express a new one called outer surface protein C, or OSPC.
So if I'm picturing this, it's like an army waking up, putting on specialized armor, and physically marching from the tick's stomach up to its salivary glands.
That is exactly what happens. That OSPC armor is completely necessary for the bacteria to survive the journey into the mammalian host.
Right.
But that internal migration from the gut to the saliva takes significant time.
Right.
Because of this complex biological bottleneck, the tick generally must be attached to you and actively feeding for more than 24 to 36 hours before it can successfully transmit the Lyme disease bacteria.
Wow. Over a day. That is a massive, crucial window for us. I mean, it means if we find the tick and remove it on day one, we can stop the infection before the army even reaches the gates.
Exactly, which is why tick checks are so important.
And it also clears up a lot of the confusion about how this spreads. It requires that prolonged physical attachment. Lyme disease is strictly vector-borne.
Completely. It is not airborne. It is not spread through food or water.
Yeah.
There is absolutely no credible scientific evidence that it is spread by touching, kissing, or sexual contact.
You can't get it from a mosquito bite or a flea either.
Right. And while dogs and cats absolutely can suffer from Lyme disease, they do not pass the infection directly to you.
Okay, so because you need to miss this poppy seed for over a day, you'd think this only happens to, I don't know, off-grid backpackers who don't shower for a week. But the demographic data shows a completely different picture of who is actually getting hit.
It really does. The geographic risk in the U.S. is heavily concentrated in the Northeast, the Mid-Atlantic, and the Upper Midwest, with, smaller endemic pockets along the Pacific coast.
Sure.
But demographically, the risk curve is bimodal. It peaks in two distinct age groups: children under 15 and adults over 45.
That bimodal curve makes perfect sense when you look at behavior, though. I mean, kids are out rolling around in the grass, playing in leaf piles, and they aren't exactly doing thorough tick checks on themselves.
No, they're not.
And older adults are out gardening, landscaping, or doing yard work. And I saw that most reported cases are in white individuals, which aligns with both the demographics of the most heavily infested geographic regions and, unfortunately, potential disparities in healthcare access and reporting.
That's right. And the environment itself is incredibly deceptive. Many people are fitting in their own backyards or just walking around their suburban neighborhood.
Yeah, you don't have to be deep in the wilderness.
Exactly. And our pets play a really dangerous role here, basically acting as Trojan horses. A dog wanders into the brush, picks up dozens of tiny unattached nymphs on its fur, and brings them right into your living room or your bed.
Oh, that's just a nightmare scenario.
Yeah, the tick then just transfers from the dog's fur onto your skin while you sleep.
Okay, so if that tick does manage to latch on for a day or two, what happens next? What does the invasion actually look like in the human body?
Well, the clinical progression unfolds in 3 stages. Stage 1 is early localized disease. This appears anywhere from 3 to 30 days after the bite. And the hallmark symptom is erythema migrans, the famous bullseye rash.
Now, a lot of people confuse this with a standard bug bite because, a small red bump that shows up immediately and fades in a day is just an allergic reaction to tick saliva.
Right, that's completely normal.
But the Lyme rash is an expanding infection moving outward through the skin. I mean, it can get up to 12 inches across.
It can be massive. But strangely, it rarely itches or hurts, though it might feel a bit warm to the touch. The terrifying part is that 20 to 30% of people never get the rash at all.
Wait, really? A third of people just don't get the warning sign.
Yeah, or they just don't see it because it's hidden on their scalp. under their hair or on their back.
Nah.
During this stage, patients often experience severe flu-like fatigue, fever, chills, and swollen lymph nodes, basically as the immune system realizes it has been breached.
So since the nymph tick is so tiny and the rash can be easily missed or just not happen, sliding into stage 2 is incredibly common.
Very common. Stage 2 is early disseminated disease. This is where the bacteria has entered the bloodstream and is traveling to distant tissues.
This is where things get really serious.
Yeah, this is where we see neuroborreliosis. The spirochetes attack the peripheral and central nervous systems. A classic presentation here is facial Bell's palsy.
That's where half the face droops.
Right. Exactly. The bacteria inflames the seventh cranial nerve as it passes through this really tight bony canal in the skull. The swelling physically compresses the nerve, causing one or both sides of the face to droop and lose all muscle tone.
That has to be terrifying for someone waking up with that. And it doesn't just stop at the nerves, it goes after the heart, causing Lyme carditis.
Yes, and this goes back to that corkscrew shape. Because of that shape, the bacteria bore straight into the heart tissue, specifically inflaming the atrioventricular node.
Which is basically the heart's electrical gateway.
Exactly. And the inflammation physically delays or blocks the electrical signals from the upper to the lower chambers of the heart, causing it to skip beats or palpitate wildly.
It's just wild what this tiny bacteria can do. But what if they don't catch it then?
Well, if the infection remains unchecked, it progresses into stage 3, late disease, which can be months or even years after the initial bite.
Wow, years.
Yeah. Severe Lyme arthritis sets in. We are talking about massive, painful fluid buildup and swelling, usually in large joints like the knees. This happens as the immune system attacks the joint tissue, trying to kill the embedded bacteria.
And it's a neurological component here too, right?
Yes. Alongside that arthritis, patients suffer encephalopathy. We're talking profound brain fog, extreme irritability, memory loss, and severe concentration deficits.
Okay, this sounds like an unstoppable cascade, but we do have a highly effective medical arsenal, provided we use it correctly. Lyme disease is a bacterial infection, meaning it is fundamentally curable.
Yes, absolutely. If caught in the early stages, the standard treatment is a straightforward 10 to 14-day course of oral antibiotics, typically doxycycline.
Although there are exceptions for kids and pregnant women, right?
Right. For children under 8 and pregnant women, amoxicillin or ciproxime is used instead, just to avoid the dental side effects that doxycycline can cause.
But if the bacteria has already drilled deep into the nervous system or the heart in those later stages, I imagine oral pills aren't enough.
No, they usually aren't. The treatment escalates to intravenous antibiotics, like ceftriaxone, administered for 14 to 21 days. The IV delivery ensures the medication hits high enough concentrations to cross the blood-brain barrier and penetrate those really dense tissues.
And when you drop this kind of heavy artillery on the bacteria, patients often experience this fascinating and honestly pretty scary biological event called the Jarisch-Herxheimer reaction.
Yes. In the first 24 hours of starting antibiotics, symptoms can suddenly and violently worsen.
It's so counterintuitive, like you take the medicine and you feel worse.
Yeah.
But it's because as the antibiotics slaughter the spirochetes en masse, the bacteria burst open. They dump a massive load of toxic cellular debris and proteins directly into the bloodstream.
Exactly. The immune system detects this massive debris field and releases a storm of inflammatory cytokines. This tricks the brain into spiking a high fever, inducing intense chills and skyrocketing joint pain.
It's an incredibly uncomfortable process, but it usually passes within a day or two as the body clears the debris.
It does. But unfortunately, clearing the bacteria doesn't always clear the illness. There is a longer shadow here called Post-Treatment Lyme Disease Syndrome, or PTLDS.
Right. And for roughly 10 to 20% of patients, the debilitating fatigue, severe joint pain, and persistent brain fog last for 6 months or more after the bacteria has been completely eradicated.
Yeah, and this is where clinical guidelines are incredibly firm. The CDC and multiple careful placebo-controlled clinical trials have conclusively shown that extending antibiotic treatment for months or years does absolutely nothing to resolve these prolonged symptoms.
Because the bacteria are already gone.
Exactly. The bacteria are dead.
Mm.
Treating PTLDS with endless antibiotics isn't just ineffective, it's actively dangerous.
Yeah, because long-term IV antibiotic use wipes out the body's protective microbiome. That can lead to fatal complications like systemic sepsis or severe C. diff colitis.
Right, so the medical approach really has to pivot from trying to kill a ghost to comprehensive symptom management, things like physical therapy, pain management, and neurocognitive support.
Given the severity of PTLDS and the difficulty of spotting those tiny nymphs, preventing the infection at the biological level is paramount.
It really is.
Which brings us to a really fascinating piece of medical history. We don't currently have a human vaccine for Lyme disease, but we actually used to.
We did. Back in 1998, the FDA approved a vaccine called Limerix, and it was highly innovative. Instead of killing the bacteria in the human bloodstream, it targeted that specific OspA protein inside the tick's gut.
Wait, inside the tick?
Yeah. When the tick drank the vaccinated person's blood, the antibodies entered the tick and neutralized the bacteria before it could ever start its march to the salivary glands.
That is brilliant. It was nearly 80% effective, too. But it was pulled from the market by the manufacturer in 2002. And it wasn't because the science was bad.
No, it was entirely about public perception. The late 90s saw a surge of early anti-vaccine sentiment and media sensationalism. Class action lawsuits were filed claiming the vaccine caused arthritis.
Even though Lyme disease itself causes arthritis.
Exactly. The FDA and the CDC investigated thoroughly and found absolutely no difference in arthritis rates between vaccinated and unvaccinated populations. But the damage was done. Consumer demand plummeted, and the manufacturer just voluntarily discontinued it.
So the scientific community lost 2 decades of protection. Just gone.
It's tragic. But there is a massive effort underway to close that gap now. A new multivalent Phase 3 vaccine candidate called LB6V or VLA15 is currently in trials.
And it uses that same brilliant strategy, right?
It does. It targets the OspA protein, but it is engineered to cover both North American and European strains.
That's huge. And there is also a completely different approach being developed by Mass Biologics and Tonix Pharmaceuticals, which is a pre-exposure prophylaxis, or pre-AP shot.
Yes, and this relies on human monoclonal antibodies.
I love this concept. So instead of waiting months for your immune system to build a defense after multiple vaccine doses, this PP shot is essentially like renting an elite immune system for the summer.
That's a great way to describe it. You get one targeted shot right before tick season, and you have instant, laboratory-crafted antibodies floating in your blood, ready to neutralize the bacteria the exact moment the tick bites you.
It could be an absolute game changer for people living in highly endemic zones.
Definitely. But until those clinical trials wrap up and the products hit the shelves, our primary weapons are environmental control and personal defense.
Right. And the mechanics of stopping a poppy seed-sized arachnid requires serious vigilance. On the skin, you need EPA-registered repellents like DET, picaridin, or oil of lemon eucalyptus.
But for your boots, pants, and gear, you really want 0.5% permethrin. Permethrin doesn't just repel ticks, it literally paralyzes and kills them on contact.
Wow. And environmental control around your home is equally vital, right?
Very much so. Ticks desiccate, they dry out incredibly easily. They need the moisture trapped in leaf litter and shaded woods to survive.
So you can leverage that biology. You can build a 3-foot-wide physical barrier of dry wood chips or gravel between your manicured lawn and the wooded edge of your property.
Exactly. This acts like a miniature desert that ticks physically cannot cross, which protects the areas where children play.
That's so simple but effective. And my absolute favorite piece of advice from the research in this deep dive is the lint roller hack.
Oh, yes.
I mean, when you get back from a hike or from weeding the garden, take a sticky lint roller and roll it vigorously all over your clothes. Because these nymphs are microscopic, they can wander on your fabric for hours looking for exposed skin. The lint roller traps the unattached ticks you can't even see.
It's such a great trick. And after that, you want to strip down and shower within 2 hours to wash off any others that haven't bitten down yet.
If a tick does manage to bypass all of that and dig in, the removal protocol is critical. Use fine-tip tweezers, grasp the tick as close to the skin surface as possible, and pull straight up with steady, even pressure.
Right. Do not twist it. And please, do not try to burn it off with a match or smother it in oil.
Yeah, that just agitates them and makes them regurgitate into the wound.
Exactly. Every hour counts. If you remove an engorged tick in a highly endemic area, contact a doctor immediately. They will often prescribe a single prophylactic dose of doxycycline to wipe out any spirochetes before an infection can even take root.
The current landscape of this pathogen in the United States is pretty sobering, honestly. Lyme disease is highly endemic and deeply entrenched in the environment. In 2022, there were roughly 62,000 officially reported cases.
But as we mentioned earlier, public health surveillance indicates that official reporting only captures a fraction of the reality. The true burden is closer to 500,000 actual infections treated annually. It's a daily public health battle for anyone stepping outside in an endemic zone.
Looking to the future, there are still massive unknowns for researchers to conquer. The pathology of post-treatment Lyme disease syndrome remains the biggest mystery.
It really is. We urgently need to solve exactly what causes PTLDS. Is the immune system continuing to react to leftover bacterial debris, like dead spear-shaped fragments that just haven't been cleared from the joints?
Or did the initial bacterial invasion trigger an autoimmune overactivation, where the body is now permanently attacking its own nervous system?
Right, the scientific community is racing to figure out the exact mechanism.
Because this bacteria and its vector represent an astonishing evolutionary adaptation. They are perfectly engineered to bypass our physical barriers, manipulate our immune responses, and persist in our tissues.
They're built for long-term survival. The looming question for public health is whether we are prepared for how their habitat is changing.
Yeah, because if climate change continues to shorten our winters, meaning we have fewer hard freezes to naturally cull the tick populations, the geographic footprint of the black-legged tick is only going to expand.
It's already happening.
Right. Lyme disease won't just be a localized problem for hikers in the Northeast or the upper Midwest. It will be an everywhere problem. If the simple, everyday act of brushing against a blade of grass anywhere in the country carries the risk of a life-altering neurological infection, how will that fundamentally reshape our relationship with the great outdoors?
It's a question we're going to have to answer very soon.
Stay informed, stay prepared. This has been Outbreak Brief.